My name is Scott Challoner, and you are listening to the Leaders Council podcast for the people who run the country and the people who keep the country running. As regular listeners of this programme will know, part of our mission here at the Leaders Council is to bring forward a variety of distinct perspectives on leadership, and today that mission takes us right to the heart of Westminster, where we have Chris Chaney joining us on the programme. Chris is the Chief Executive of CW+, the official charity of Chelsea and Westminster Hospital NHS Foundation Trust. Chris, very warm welcome to yourself today, and by all means thank you for joining us. It's a real pleasure having you.
Well, thank you so much for having me back on.
It's a real pleasure, Chris, absolutely. It's not, of course, your first time on the programme, and whenever we have had anybody from the healthcare industry coming and joining us on the show, particularly over the last couple of years, obviously a major topic has been the COVID-19 pandemic and how we've sort of charted a course through that. Now, mental health is something we've become much more acutely aware of during COVID, specifically young people's mental health. It's never really been more present in the public consciousness as we've sort of come out of the pandemic. Could you actually tell us a little bit about the national picture for mental health and why that's something that we should all be thinking about at this stage?
Well, thank you. Yes, so I think children and young people's mental health has been kind of like has had a growing voice in in healthcare and in public consciousness, probably going back into, I suppose, the kind of 2010s, early 2010s onwards. And I think there's been an awful lot of focus, energy and investment in that time to try and support children and young people to, I suppose, be kind of more aware of their own mental health, and also to understand that there are networks of kind of healthcare providers and other organisations from schools and colleges, third sector organisations and other fantastic initiatives that they might be able to draw on. But this was very much in a response to, I think, probably a slight change in societal mood, and obviously there's been a lot of shift in that in this last decade in terms of socioeconomic circumstance across the UK, and some of the disparities that are brought out about that, which exacerbates mental health and the inequalities that often are at the root of some of the mental health challenges that we see young people and facing today. Obviously, when the pandemic hit, that changed. That changed the dynamic once more, and a lot of the support networks and infrastructure routines that children and young people were able to call upon were taken away. And I think what we're seeing now as we come out the other side of COVID is probably the tip of the iceberg in terms of a huge growth, tragically, in the number of children and young people experiencing kind of mental health crisis or severe deterioration in their mental health. And currently, I think as a society, as a healthcare system, as an education system, we are looking at how do we manage this? The old mechanisms, in some ways, can cope to a point. In other ways, they are struggling and are getting overwhelmed. So I think now is the moment, and there's an awful lot of dialogue at a national government level to think, how can we actually start to reimagine how we provide this care, and how can we really put children and young people at the heart of that conversation?
Yeah, and it's hugely important, isn't it? Because at this present time, I think it's only 25% of those children and young people that actually need mental health support are getting that support. And obviously there are you mentioned the word disparities there. Children from ethnic minority communities are less likely, actually, aren't they, than their white counterparts to access traditional mental health services. And then if we look at the LGBT plus community as well, we're seeing a high proliferation of mental health issues within that community compared to some of their peers as well from the heterosexual community. So there are disparities there as well that do also need to be addressed, as well as the fact that people more broadly who need this support, they need to be getting it more.
Exactly that, and I think this is something that we have to be acutely aware of when you're looking to address this set of challenges. That there is certainly not a one-size-fits-all approach, and understanding the root causes is only one part of the challenge, but also understanding kind of the infrastructure around children and young people. what their belief systems, the communities that surround them, how mental health is discussed or not. Is it still stigmatized? Is it the right thing to talk about? Is it the wrong thing to talk about? It, assuming that everybody's kind of in the same place is absolutely the wrong thing to do. And some of those groups that you just mentioned, I think we're seeing, often see the sharp edge of that. So we certainly do see that disparity playing out.
And obviously, if we don't address sort of mental health properly, that can also cause sort of a lot of the factors that impact overall sort of physical health and well-being, can't it? Because, your chances of education attainment and employment go down as sort of other risks increase, and obviously it can lead to sort of difficult lifestyle choices, such as obviously eating more, drinking more, for instance. So, mental health, it's a bit of a vicious circle, isn't it? It sort of ties everything together, and if you don't have that sort of right headspace and that isn't addressed properly, there can be consequences elsewhere, can't there?
Completely. I mean, I think if I think you have a window with children and young people to try and provide that framework and to try and address the mental health challenges that they're facing. If you don't, as you say, that the chances are that you will be carrying that as an individual into your adult life. And as you have greater access, as you say, to make your own choices around your diet and your lifestyle and other things like that. If those underlying challenges are there, there's a very good chance that that you'll end up with a slightly with a mixture that will not necessarily end up in a positive situation. And I think one of the key things, coming back to healthcare systems, I think lots of people, I'm sure lots of people listening will be, you associate the NHS at the moment with this idea of recovering from the pandemic and prevent, moving away from caring for, kind of like providing care in hospitals. So how do we start preventing these things? I think we have to apply the same thing, the same approach and mentality to mental health as we are now starting to do with physical health. If we can avoid, an individual becoming a patient into their adult life by looking to provide the right support, infrastructure, interventions when they're younger, I think that's absolutely the right way to do it. And ultimately, that's much, much better for the individual. It's much, much better for the system and society as a whole.
It is, exactly, for sort of moving the focus onto prevention as opposed to treatment. I think that's absolutely the way to go. And your organisation as well, Chris, CW Plus, is taking a much more active role in working across various organisations and regions to actually support the health of the UK population. So how did you sort of come to sort of make these moves, and why has this been an important step for yourselves to take, do you feel?
It's a good question, and there is it wouldn't be immediately obvious why we would be doing this, given that Chelsea and Westminster hospitals, who are our healthcare partners, our primary healthcare partners, Chelsea and Westminster Hospital is what we call an acute general hospital. So we aren't a mental health specialist organisation. We do have a big cohort of children and young people who come to us via our A&Es and other paediatric services. But the whole conversation about us getting involved in this field actually began with a member of our development board approaching us and saying, this is something, I've had personal experience through my family of the mental health system in the UK and overseas. And on that journey, I've met a lot of people from all different walks of life who are telling me stories about kind of the inconsistency in care and support that they receive. Sometimes it's great, sometimes it's really not as good as it needs to be. And his view was that we could do this better. And his challenge, and it was a simple question: do you want to try and team up and see if we can come up with a better solution here? And it was a great question. It's a great challenge. And I walked away and sat down with the chief executive at Chelsea and Westminster and the medical director and the chief nurse. And it became very clear very quickly that this was something that was very relevant to Chelsea and Westminster. So we were starting to see, and this is a conversation that was taking place probably 2017, 2018. But we were already starting to see over a 5-year period prior to that a steady increase in the number of young people coming to our A&E in mental health crisis. And a lot of that was children and young people presenting in the mental health system in inverted commas for the first time. And and we all know, and we all knew, and we continue to know that A&E is not the right place for young people at that point. We can help immediately, but actually, if we can avoid that situation and avoid potentially that young person ending up in hospital for a prolonged period of time, when that might not necessarily be the right place for them, we knew that was something we had to do. So we're already seeing this tick up. So we sat down and said, okay, well, Chelsea and Westminster, we're a small part of this big picture. And it became apparent that we needed to go and, in essence, build a coalition. If we really wanted to think about how to kind of shift the dial a little bit on this, we'd have to go and work with other organisations. So we went and approached, in our area of London, our big NHS mental health providers, so Central North West London and West London Healthcare, and they were on board straight away. So you've got organisations there that provide specialist community care, so CAMS services. You've got community support services. You have specialist mental health inpatient services. So all of a sudden we had a little NHS coalition going on. But again, what we knew that wasn't going to be enough as well. If we really wanted to reach our kind of catchment population as a starting point, and I should say it is a starting point because the ambition of this programme is that this should reach out beyond our area of London, actually across the whole UK and potentially beyond. We've got, I think, approximately 500,000 under 18s on our doorstep across the 8 boroughs that make up our integrated care system. So we had to think about how we can actually go, take a program to them. How do we engage that big group of people across this diverse area? And what is a very vibrant, multi-ethnic population across a big geographical area. Again, expecting people to come to NHS services wasn't the right way of doing it. So we needed to start thinking about community partners, and we needed to start thinking about actually, what do young people want? So a big part of this initial set of discussions was sitting down with young people, with families who had lived experience, and saying, what's the missing piece for you? What are we not doing? What is the system not providing for you? And we got some really fascinating answers out of that.
Yeah, that's fantastic. And as a result of that sort of consultation, if you like, I understand that some very, very promising programs have actually come out of CW Plus that are sort of scalable and can support more people. And could you just sort of tell us a little bit more about some of those?
Yeah, so after we kind of, I think after this kind of initial round of conversations, we pulled together, I suppose, an expert panel of clinicians and academics, so young people, parents with lived experience, and kind of mental health experts from across the UK, and started asking views in terms of, in essence, kind of, if the answers are sitting there under our nose, what would you change? And we landed with a program that is now called Best for You, and Best for You launched officially in November last year. And Best for You, in essence, is a program that tries to provide a kind of rounded approach to how we can provide support for our population of young people, and that's everything from care in hospital all the way to when you're at home, and hopefully that preventative side of things. So Best for You, if you break it down, is almost like 4 quadrants. You have, as I said, your in hospital piece. So we're in the process of designing what will be a state-of-the-art new young people's unit at Chelsea and Westminster. So that's to avoid that bottleneck of young people coming to A&E, getting stuck there. And there's a whole new model of care that sits around that. So both in terms of how we put the staffing model that we provide, the multidisciplinary teams who can intervene immediately, but also we've designed that unit in line with an ambition that the NHS laid out in its long-term plan in 2019, which is to have young people in that environment assessed and then hopefully got back home or into an appropriate setting within 72 hours. So part of that unit will be a rapid assessment unit, which is something that we're working very closely with our paediatric colleagues on, but also with representatives from the national NHS team on as well. So in hospital is one piece of it, but as I said, that's the kind of, that's the bit where we're trying to avoid, but we know it's there and we have to improve when people come. So it's kind of what happens before that and what happens after that. So we're also building an aligned day centre, which will be opening in this autumn. And that's a place where, in essence, it's a walk-in centre for young people and families. It's also a space where we'll be able to provide some clinical care that we don't think needs to take place in a hospital setting. So again, it's a kind of a way of hopefully it's a safe space for young people either before they come into hospital, before they feel the need to come to hospital, or if they've been discharged, it's somewhere they can go without having to think about going back into the A&E system again to hopefully de-escalate the situation. And again, kind of mixed model, everything from trained volunteers with lived experience and digital experience, all the way through to youth workers and clinical staff. So that's going to be a really kind of novel approach that, as I said, we're launching in the autumn. The third piece, and the piece that we launched at the end of last year, is a digital portal. So obviously, in our consultations with young people, we have the group of people who we're trying to reach here. They're digital natives. So I think in our surveys there was something along the lines of 42% of young people said they are online constantly in their lives. So obviously, communicating through digital channels is absolutely critical. So we launched Best View NHS as a new digital portal. And that brought together both kind of a whole series of relevant content, signposting to other services in our local area, some great partnerships with companies like YouTube, who we've just actually done a series of films with over the course of Mental Health Week that's just passed. But also, the thing probably that's kind of most clinically interesting about this platform is that it has the country's first vetted kind of mental health app library. So it is a place where you can go and find everything, kind of tools to help you with everything from sleep, anxiety, depression, all the way through to kind of some of the more severe kind of self-harm, eating disorder kind of conditions. Everything on there has been vetted. It's been vetted clinically. It's been vetted by the company Orca, who works with the NHS to vet and moderate apps that the NHS recommends. And it is a kind of one-stop shop. And we found that that's something that both young people have found incredibly helpful. It's now getting over 1,000 visits a month, but also clinicians as well, who are starting to actively use digital as part of their treatment plans in a very active and proactive way. So it's a really helpful resource for them. So you've got the three domains of in hospital, out of hospital, day centre, community program, outreaching out into the community. Digital is a thread that runs all the way through it. And then the final piece of the puzzle is, well, how actually can we show that this is working? And the first steps that we took before any of this was putting together a fantastic team to help us with kind of research and evaluation. And that's a team from Imperial College and the National Institute of Health Research, our local applied research collaborative. And they've been fantastic in really kind of helping us challenge us in terms of kind of what are the questions you're trying to ask it? What are the problems you're really trying to solve? Does the data stack up to what the anecdotal evidence is saying in terms of making some of these decisions? And critically, can we then template this model so it can be shared with other healthcare systems and quickly adopted?
And it would be incredible for that to happen, wouldn't it? Because this is something that's been developed with young people for young people, and is a really unique first of its kind model of mental health care and support, and it's multifaceted as well, isn't it? And it is a large but sort of very much needed program, because 1 in 6 young people do experience a clinical significant mental health problem. And if we just look at northwest London, for instance, that equates to 37,000 youngsters within that region alone. So it is such a much needed program. But to make that program work with everybody, with all of those people involved as they are, I suppose that having sort of a clear and strong leadership structure is incredibly important for it to execute its success as well. And how has that sort of been established, would you say?
Yeah, so we've established, I suppose you're absolutely right, the kind of governance around the program, particularly the diversity of the partners we have and the kind of multifaceted nature is really, really important. Otherwise, you start losing track of all the threads and hairs that are running. So we have we have clinical subgroups for each of the different domains I've just described. So the in-hospital piece, our young people centre, we have a subgroup for that's chaired by our head of paediatrics at Chelsea and Westminster. We have a subgroup for day centre and community program that's chaired by one of the senior clinicians at Central North West London. And then we have a digital board as well that's chaired by the head of digital and CAMS at West London. So we have that kind of clinical leadership embedded in each of those areas. But then we also, above that, we have an oversight board, which is a mixture of NHS leadership. So we're delighted that we have the chief executives of our NHS partner organisations, which includes Leslie Watson from Chelsea and Westminster, Carolyn Regan from West London, and Dame Claire Murdoch from Central North West London, who is also the National Director for Mental Health in the NHS, sitting on that group. But we also have some other fantastic people. It's chaired by Kasim Kutai, who is the Chief Executive of Novo AS, and the big pharma group out of Denmark. He was the person who initiated these discussions, so Kasim's leadership has been instrumental in this program from the outset. And we also have some other fantastic subject matter experts, people like Obi Felton, who used to run the Moonshot unit over at Google in California, who is one of the digital experts who we were so keen to get involved in this program to really help shape and guide us in terms of thinking about new technologies and new ways of working with digital and this group of patients.
Yeah, it's amazing, isn't it? So it's very much kind of three levels of leadership there. You've obviously got the input from sort of the clinical leadership and, on the other hand, the operational and senior side. But also, it's a program that's led by young people as well. It's led by what young people are telling you. And obviously, every single element has got to kind of work as a kind of a single offer, because if obviously it doesn't work, young people are going to spot this and not engage with the program how you intend. So it's important to make sure that you get the message right, isn't it? Obviously moving forward with this.
Absolutely right, and I think that's something that we built in from the outset. So we have young people representing the program on that oversight board, and their voices kind of hopefully play through every different facet of this program. And as we reach out into our community, we've got more and more partners who we're working with who have these big networks of young people who can help us in terms of design, content, thought processes. Are we making the right choices? Are we investing in the right way? We've got fantastic partners like Word on the Curve, who can reach a group of 10,000 young people from a whole variety of different backgrounds. So those kinds of partnerships are absolutely critical. We also have partners closer to home. We have fantastic relationships with organisations like Chelsea Football Club, who've got a whole range of community programs. We're working very actively with them, and then some organisations that focus on specific areas, specific kind of areas of the community, specific demographic groups. So we're trying our best to always be kind of reaching out and finding ways of accessing as many young people as we can, from many different backgrounds as we can, and adapting our material and our messaging to make sure that it is as inclusive as it can possibly be.
And it is starting to really have ripples in the communities that need it, isn't it? Because during the recent Mental Health Awareness Week, the programme had over 20,000 Twitter impressions and also over 6,000 viewers on YouTube looking at the sort of Best View homepage videos as well. So the content's getting out there, isn't it? And I suppose now it's a case of trying to sort of kind of scale that up and get that message out even more.
Exactly that, and obviously this is helpful. The digital platform is a free access, open source tool, so anybody can access that. But no, we're really pleased with the traction that it's getting, and I think, as you say, our job for 2022 is always going to be, in essence, kind of marketing this service and this support offer to young people. And we've made some great headway already this year. We're working with some amazing organisations. We're working with already 7 colleges and universities across North West London. We're working with amazing organisations like the London Group for Learning, which has got a network of 3,000 schools who are using that digital tool. So we are doing everything we can, as I said, to reach as many people as possible, and also show professionals from any sector who actively work with young people that there's something in there that might be able to help and support them as well, that they can access. And critically, as we kind of build those networks, we find people who are doing amazing work all the time. One of the other kind of bits of ethos around Best for You is that it's deliberately designed not to duplicate and not to kind of start with a blank piece of paper and do that kind of big organisation thinking of going, oh, we'll just do it all ourselves. We're actively looking at to find organisations, to find partners, to find individuals, youth groups, anybody who has got a track record of doing great work with young people. We want to be able to signpost more young people there. We want to be able to put your organisation on a pedestal. We want to be able to say, this is an amazing service. It's something that could definitely help you to the children and young people in and around that local community. And by just taking that approach, I think we're getting a really great response. People want to come and work with us. But I'd say anybody who's listening who works in this space, please do drop a line and get in touch, because we are always actively looking for partners who we can promote.
Yeah, fantastic. And if there is anybody listening in who sort of wants to engage or learn more about the overall project, what are the sort of best avenues to go down with that, Chris?
So I think the best, I think obviously look at if you want to log into bestviewNHS.org, that is our window to the world, or CW Plus, other CW Plus website as well. So I think there are easy contact details there. As I said, if you're a clinician who wants to find out more, if you're a teacher, if you're a nurse working with young people, there is information for you there. If you are a parent, a carer, a young person, there is information and content that hopefully you'll find useful there. And if you want to have an active conversation with us, there's contact details on both websites. You can get hold of me or any of the program team through those mediums.
Absolutely. Been over 5,000 visits to the platform since it's launched as well, so certainly gaining some real traction. And I think the awareness of sort of young people in increasing kind of their activity levels and how that can benefit their mental health is really improving as a result. I've got 87% of children and young people, a statistic in front of me here, who said that mental health has improved with sort of more activity. And that's not just physical, that's obviously just any kind of sort of activity keeping your brain busy. And, it's important, isn't it? Just really getting that awareness out there.
Exactly. And I think it comes back to that idea of we were talking as a group recently, and we kind of landed on this idea that we want people to stay as people. We don't want young people to become patients. And so it's not just about the jargon of prevention and wellness and all of these different things. But ultimately, we want you to be able to live a life that you want to live and not have mental health as a barrier to that. We can help you. We can help you at any stage of that journey. And hopefully those people who surround you, who you trust, who you love, who care for you, we can hopefully help them as well.
Fantastic. And if, just before we finish, Chris, I ask you one final question. 12 months from now, where ideally do you see sort of best for you as a programme being? What is it that you really hope that it's achieved by that point?
So I think 12 months from now, I'd like to say that Best for You has got a template model for how digital can have a transformative effect and across the population of young people in an urban setting. I think Best for You should be able to show a fantastic track record from an NHS point of view of how to engage and work with community partners in a very proactive and mutually beneficial way, as opposed to trying to duplicate services. So I think we'll be able to show some real evaluation there. I think in terms of the numbers of young people we want to be able to reach, I'd like to say that we will have made great headway in terms of accessing that community of 500,000 people in northwest London. But also, in 12 months from now, I'd like to think that we're starting to accelerate some of the conversations with other healthcare systems, be that in Oxford, who I know we've already started a conversation with, or Manchester or Glasgow, where we've got engaged colleagues already to start to think how we can start to shift in real time some of the work that we're doing to other bits of the UK as well. And I know there's some real enthusiasm for that. The final bit I'd say is that we will also by then hopefully have a really interesting model of how to create a day centre near a hospital, near an acute setting, and actually how that can act as a staging point and hopefully a point of prevention. So as an alternative for young people who might be thinking about the need to access hospital care, actually we're going to give them a viable alternative, and hopefully I think that could be something that could, again, be really transformative for a lot of hospital and healthcare systems across the UK.
Yeah, let's keep our fingers crossed on that, because there is some incredible potential within this programme, and we'll certainly be keeping a very close eye on sort of how it grows and develops from here. And let's hope, of course, that the trajectory remains positive. And as we do start to see it sort of taking more of a shape, Chris, I relish the opportunity to bring you back onto the programme and catch up on how things are coming along, and hopefully there'll be some real positive traction to talk about.
Absolutely, thank you. And it would be remiss of me, Scott, so a huge thank you to you, but also to take this opportunity to thank all the incredible partners, young people, organisations who kind of rallied around us, lighting the flare on this particular programme. And also a huge thank you to the incredible supporters and community of philanthropists who kind of rallied around us as well. The NHS is prepared to invest its money in making this program work effectively. But the seed funding to set up some of the elements of the program I've described today has been entirely through philanthropic sources. So it would be remiss of me not to say a huge thank you to our community of donors who are standing with us on this.
absolutely an incredible amount of generosity. And to anybody again tuning in who wants to find out more about the programme, I'd just like to reiterate that your best sources are the CW Plus website, that's cwplus.org.uk, and also the Best For You site at bestforyou.org.uk. And if you are a young person who's tuning into this as well, you can also follow the programme on social media, that via Best For You NHS. Chris, once again, thank you ever so much for your time in joining us on the programme today. It's been an immense pleasure having you with us, and do by all means take care and stay safe with all still going on in the world as well.
Thank you so much, Scott. Look forward to coming back again soon.
It was a great pleasure welcoming Chris Chaney from CW Plus onto today's programme, and I do hope that every tune thoroughly enjoyed the interview today. Just to remind everybody listening in, if you do happen to be somebody who runs your own business or your own organisation with its own story of success and innovation to share with us here at the Leaders Council, then by all means we also want to hear from you. So why not also apply to be on our programme via leaderscouncil.co.uk/apply. Until next time, to every single one of our listeners, you've been listening to the Leaders Council podcast with your host Scott Challoner. Do take care and goodbye.